Hello, this is Boyeon Kim, Head of Clinical Research Team of Korea Tooth Bank. So far, we introduced the feasibility of Moldable AutoBT dentin powder in ridge augmentation and GBR, which has osteoinductive, osteoconductive, and remodeling capacity in sticky form. Today, I will present the simple surgical procedure of ridge augmentation and GBR using Moldable AutoBT, dentin powder being focused on technical aspects. 62 years old male patient has buccal abscess due to tooth mobility on 1-4 and 1-5. Since the patient was unwilling to extract the teeth, the hopeless teeth have been left unattended for a while. By this time, buccal abscess from 1-5 was progressed and decided to extract it. We planned the GBR prior to implant placement on 1-5 due to severe inflammation and thin sinus floor, which is difficult to secure primary stability. On 1-4, we planned immediate implant placement after extraction because we could get enough primary stability. GBR and ridge augmentation were planned 2 weeks after extraction on 1-5 and around 1-4 with implant to get rid of remained inflammation in and around the alveolar socket. In order to remove residual inflammation during these 2 weeks of waiting period, it is advantageous to loosen the suture as shown in the picture after extraction and implant placement. From now on, let's see the ridge augmentation and GBR by applying Moldable AutoBT. Reopen flap with vertical incision and lightly remove the less mature granulation from the upper part and remove the residual inflammation of the soft tissue by trimming it well. The flap used to be reflected very easily 10 days after the first surgery. Once the socket is well trimmed off without any residual inflammation, prepare the Moldable AutoBT to be ready for transplantation. Add saline or patient's blood to Moldable AutoBT dentin powder and mix it in the same way as the alginate until it becomes viscous for about 20 to 30 seconds. With sufficient viscosity, cylindrical or circular shape can be formed by rolling it with the finger to make it appropriate for the grafting site. The circular shape of dentin is moved to the 1-5 GBR area, and as you see, it is viscous enough to be held and moved with tweezers. Press it lightly with instrument or finger to adapt it to the defect. Next, move the second moldable around the 1-4 implant and fill up the spaces. Since type 1 collagen is the main component of AutoBT, which acts as a sponge that attracts blood, be sure to check the blood absorption as shown in the video and do the usual watertight suture. This is CT scan before tooth extraction of 1-4 and 1-5. Right picture on each side represents ridge augmentation for 1-4 and GBR for 1-5, 10 days after implantation. The messages for today are: first, Moldable AutoBT is sticky enough to fit in the defect to be repaired. It absorbs the patient's blood well enough. Second, the volume and shape are well maintained in the defect after absorption of patient's blood. Third, overall, there is no need to use membrane when using Moldable AutoBT dentin powder. Therefore, in the next lecture, I will introduce the long-term observation data of Moldable AutoBT in ridge augmentation and GBR. Thank you for your kind attention.